you're watching this video because you have pelvic floor dysfunction in the forms of one or many of this list that I'm about to give you. It could be incontinence, it could be pelvic floor pain, muscles of the pelvic floor being weak, having trauma to your pelvic floor, having other symptoms that people really don't necessarily associate it with pelvic floor dysfunction. Things like lower back pain, sacroiliac pain, hip pain, lower ab issues, things like that. What's so frustrating is there's so many different things out there, and yet people with pelvic floor dysfunction still have their issues. So the treatments are either partial treatment or they're just not the right treatment. Certainly medication is not going to help it because you don't have deficiency in some medicine that caused the problem. Unless you address the cause, you will always have these issues. And the key ingredient to the treatment is to address the problem in a timely manner before there's a structural damage. What is so unique about the treatment we provide for pelvic floor dysfunction patients in our office is the fact that my specialty is postural neurology and functional movement. That combined with emsella chair, which provides up to 400 kegels a minute, that's more than one a second, to strengthen the floor muscles. But the floor is not just hanging there free floating, it's attached to the pelvic inlet, the whole pelvis. It's like the lining of that bowl, that girdle where the pelvis is. So without addressing the whole package, you're not completely addressing the problem. A lot of times people go to physical therapists who do manual insertion of their hand inside the vagina or the anus and that treatment is very helpful. But again, it's not complete because the floor, once it's addressed properly, once it's strengthened properly with emsella chair, now needs to be learning how to work with the movement, how to work being associated to the rest of your body. And that is where the failure happens. We go see physical therapists when they do manual pelvic floor treatment. We go do physical therapy to just do the exercises as if that pelvic floor muscles are living by themselves. What we fail to realize is in the whole process of the pelvic floor being dysfunctional, that component in movement has been compromised. The modification has taken place. The way the brain sends command to those areas to work along with the rest of your body has been compromised. And without addressing it, that blueprint of movement is the old way before the pelvic floor was addressed. So when you come to our office, we assess you comprehensively. We address the strengthening of the pelvic floor muscles using the emsella chair. We incorporate that with postural neurology to see how the blueprint of your movement has changed due to the lax. And then with functional movement exercises, the baby exercises, the exercises all babies on this planet do to move from infancy and be able to be fully mobile, walking and running. All of those together not only address the weak pelvic floor muscles, but allow those muscles to now work with the rest of your body in movement. Now you're all packaged together exactly the way you were before your pelvic floor dysfunction. It is absolutely crucial, and none of that is happening. We can't provide partial care to a problem and expect a full recovery. That's just not going to happen. If you have any questions, please contact us and we will be more than happy to explain to you what's going on and how we can help you enjoy your life the way you should. Thank you for watching.